Assalamu alaikum wa rahmatullahi wa barakatuh. Today we will talk about practical pathology of hemodynamic disorders. The health cells and tissues depends not only on an intact circulation to deliver oxygen and remove wastes, but also depend on normal fluid homeostasis. يعني the cells, they are not only required to intact or يعني supply by oxygen and remove their wastes, but also it is required to fluid homeostasis, normal fluid homeostasis intracellularly in the surrounding environment around the cells. Normal homeostasis maintain vessel wall integrity as well as intravascular pressure and osmolarity within certain physiological ranges or limits. Changes in vascular volume, pressure or protein contents or alteration in endothelial function affect the net movement of water across the vascular wall, and this movement of water or fluids across the vascular wall, which means extravasation into interstitial spaces, is called edema. So edema is increased fluid in interstitial spaces. Normally the approximately 60% of land body weight is water, with 2/3 intracellular and the remainder in extracellular compartment, mostly in interstitial tissue, and only 5% of total body water is in blood plasma. This some terms refers to collection of fluid in the body cavities, in the thoracic cavities, hydrothorax, and pericardium, hydropericardium, and peritoneal cavity, hydroperitoneum, more commonly called ascites. Anasarca refers to severe and generalized edema with a profound subcutaneous tissue swelling. Causes of edema. There are different causes of edema, such as increased hydrostatic pressure, which maintained by sodium salt concentration, reduced plasma osmotic pressure, which mostly associated with hypoproteinemia due to loss of protein content in plasma protein. Lymphatic obstruction due to inflammatory reaction or pressure by neoplastic infiltration. Sodium retention associated with water retention, inflammation resulting in inflammatory edema. This figure illustrates the mechanism by which form the edema. Normally the hydrostatic pressure and there is an balance between hydrostatic pressure and osmotic pressure across the capillary bed. Increase hydrostatic pressure or decrease in osmotic pressure, this will result in a collection of fluid in interstitial tissue, resulting in edema. And in the normal state, the extravasated fluid يكون balanced with drainage, lymphatic drainage through the lymphatics in the interstitial tissue. Through the lymphatics, shear absorption with drainage of this fluid collected in interstitial tissue into lymphatics and then into thoracic duct and return into circulation by subclavian veins. Morphology of edema recognized grossly, يعني دائما نشوفها انه grossly الedema microscopically manifests only as subtle cell swelling, cellular swelling with clearing and separation of extracellular matrix مثل ما شفنا بالانفلاميشن يصير extravasation واللي نسميه هناك inflammatory edema يكون اكو فد loss connective tissue يعني اكو فد white area represent يعني كل accumulation of fluids فيصير loss connective tissue or loss extracellular matrix. Any organ or tissue in the body may be involved by the edema. Here typical example about localized edema. طبعا الedema ممكن أنها تكون generalized involved of the body أو أنه تكون localized for يعني restrict for certain affected organ or tissue in the body. مثلا إذا كان due to يعني الإديمة due to hyperproteinemia نتيجة تصير يعني liver hepatic failure فيصير decrease in protein plasma protein synthesis هنا راح تكون generalized إديمة ممكن involved all part or organ in the body. And sometimes يكون localized يكون associated to obstruction in the lymphatic drainage or thrombus يسبب لنا localized congestion مثل deep venous thrombus. Here typical example about localized edema in the right leg of patient due to filariasis. Filariasis يعني parasitic infection inducing chronic inflammatory reaction and result in fibrosis and obstruction of lymphatic drainage of inguinal area يعني lymphatics and inguinal lymph nodes يصير بها fibrosis بيصير يعني failure or prevent of lymphatic drainage resulting in edema due to collection of excessive collection of fluid associated with swelling of يعني genitalia external genitalia and lower extremity مثل يعني as we see here and this refers to or called elephantiasis انه كأنه رجل الفيل هاي localized edema. عندنا subcutaneous edema had different distribution depending on the cause ممكن أن تكون diffuse واللي قلنا دائما تكون مثلا في حالات النفروتيك يعني syndrome اللي يكون بها loss of protein أو dysfunction renal dysfunction اللي تكون more severe than cardiac edema اللي سببها مثلا congestive heart failure or other initially manifest in the lost tissue particularly يعني lost connective tissue particularly in eyelids and causing periorbital edema. دائما اللي سببها nephrotic syndrome تبدي edema in the lost tissue in the eyelid periorbital edema. Localized highest hydrostatic pressure region مثلا بالleg long standing دائما يصير edema associated with the edema in the sacrum when recombinant حالة الريكومبنسي نشوفها بالساكرم is a prominent feature of cardiac failure particularly the right ventricles لأنه راح إذا صار عندنا failure بالرايت سايد راح يصير عندنا blood hypoperfusion. This will induce the renin-angiotensin aldosterone axis leading to sodium retention, and sodium retention associated with water retention and reabsorption increasing the hydrostatic pressure, and the hydrostatic pressure will result in edema. Finger pressure over the significant edematous subcutaneous tissue depletes the interstitial fluids and leave finger-shaped depression. What we call it pitting edema. يعني بنسوي بالفينجر يعني pressure على ال affected sites راح يصير displacement of underlying fluids accumulated in interstitial tissue فراح يصير ال depression of finger. edema يعني أكيد it is point to underlying disease and it can impair wound healing and complicated with infection لأنه تعتبر favorable site to infection. عندنا هنا ال periorbital edema اللي هي due to minimum change disease. periorbital edema due to minimum change disease فيصير عندنا hyperproteinemia or nephrotic syndrome. هنا هي typical example about the pitting edema. Other example about the pitting edema. This is example about pulmonary edema. Which appear as frothy edematous fluid. يعني تكون severe ومسيف وفول the alveolar spaces وتكون دائما frothy وتكون يعني frothy sputum. ومرات في حالات السيفير ممكن أنه يعني exit through the nostrils or mouth. pulmonary edema also يعني most frequently seen in the setting of left ventricular failure. لأنه راح يصير failure يعني venous drainage pulmonary vein, but also occurring in the renal failure. Adult respiratory distress syndrome الARDS, pulmonary infection, hypersensitivity reaction ممكن أنه يكون associated, all of this associated with pulmonary edema. Lung are typically تكون 2 to 3 time of normal size. أكيد راح يصير increase its size. cross section ممكن أنه يصير عندنا outpouring of frothy fluid ويكون mixed with RBCs وتكون frothy لأنه يعني due to presence of air in alveolar spaces and interfere with gas exchange and respiratory function, of course. This microscopic feature of edema represented by accumulation of pinkish homogeneous fluid in the alveolar spaces containing of some or few inflammatory cells, and nearly all of the alveolar spaces filled with fluid. This is typical example with infiltration of inflammatory cells in the alveolar septa appear prominently. And also this will interfere with respiratory function. Edema of brain, which may also localized or تكون focally restrict بحالة الأبسس أو النيوبلازم تكون localized or affect certain area of the brain, or sometimes يكون generalized. With generalized edema يعني all of the brain will affect. The brain is grossly swollen with يعني appear swelling of the and distended gyri and narrowing of sulci due to excessive accumulation of fluids in cerebral tissue, and the flattening against the under-yielding skull. Flattening being flattened due to distension of the cerebral tissue against the over skull bone. If it is severe, the brain substance or the brain tissue may be herniated through the foramen magnum, and this, considered as life-threatening stage, may lead to death. يصير عندنا herniation of لأنه يصير pressure of cerebral tissue على الcerebellum، فيصير herniation of cerebellum tonsils through the foramen magnum، وهنا يعني تكون life threatening و lead to death. هذا gross feature of brain edema or cerebral edema being severe widening of gyri and thinning of or narrowing of sulci. لأنه ما يكون هناك يعني suitable or sufficient space to involve the distended cerebral tissue، فراح يصير البريشر على الcerebellum and herniate the cerebellar tonsils through the foramen magnum, such as this example associated with acute cerebral edema, which can also often produce herniation of the cerebellar tonsils into foramen magnum and forming the cone shape of the cerebellar tissue around the medulla oblongata. Hyperemia and congestion. Path of hyperemia and congestion indicate increased volume of blood in a particular area. Hyperemia is an active process resulting from augmented blood flow due to arterial dilation. For example, at site of inflammation، حالة الانفلاميشن اللي أخذناها يصير vasodilation or arterial dilation، بيصير يعني increase blood flow. Or in skeletal muscle during exercise، في حالة physiological exercise تمارين. The affected tissue is redder because of engorgement of area with oxygenated blood، لأنه الارتريال blood يكون oxygenated فراح يبين يعني erythematous و red. In contrast of congestion is a passive process resulting from impairment of venous drainage from a tissue. It may occur systemically as in cardiac failure, or it may be localized resulting from an isolated venous obstruction، مثلا في حالة الثرومبوسيس أو الامbolism. The tissue has a blue-red color or means cyanosis due to accumulation of deoxygenated blood، لأنه يصير obstruction بالفينوس drainage، راح يصير collection or accumulation of deoxygenated blood in the affected site. Congestion and edema commonly occur together، يعني دائما نتيجة الcongestion هو يعني هو يعتبر important cause of edema. الcongestion دائما الcongestion خصوصا مثل عندنا بالبلمونري congestion يكون associated with edema، لأنه يصير increase hydrostatic pressure. increase hydrostatic pressure يكون associated with extravasation of fluid into spaces يعني adjacent spaces or interstitial tissue. This figure illustrates the example of normal arteriole and veins in the hyperemia only increase blood flow due to arterial dilation, such as exercise, inflammation, with presence of nearly normal venous site. While in the congestion there is decrease in venous outflow due to localized obstruction congestive heart failure لأنه ما راح يصير or failure of right side of blood. راح يصير accumulation and collection of deoxygenated blood at the affected site. فيبين sinuses while in hyperemia the affected area appear erythematous or hyperemic. Microscopically or the acute pulmonary congestion, grossly the affected lung appears swollen with shining pleura, sometimes يكون admixed with RBCs يعني hemorrhage with edema. Fluid flow out the lung during the cut of lung parenchyma. نسوي cutting للإديماتس lung راح يصير outpouring of fluids و sometimes يكون mixed with RBCs. Microscopically characterized by alveolar capillaries engorged with blood and the alveolar cavities filled with eosinophilic edematous fluid. Alveolar cavities or alveolar spaces filled with eosinophilic edematous fluid. And or focal minute intra-alveolar hemorrhage لأنه يكون sometimes يعني associated with extravasation of RBCs. Here is a typical example of microscopic appearance of pulmonary edema as a typical example about acute pulmonary congestion. قلنا دائما الacute pulmonary congestion associated with edema لأنه يصير increase in the hydrostatic pressure و increase of the hydrostatic pressure هو يعتبر main or important cause to extravasation of vascular fluid into adjacent tissue. هنا صار عندنا accumulation of pinch homogenized edematous fluid in the alveolar spaces containing only a few inflammatory cells, and the inflammatory cells start to infiltrate in the alveolar spaces while the alveolar blood vessels appear congested and engorged with blood and RBCs. In a chronic pulmonary congestion, grossly the affected lung appear hard with brown spots scattered, brown induration تصلبات قهوائية تكون على السيرفس مالته. Microscopically the septa become thickened due to fibrosis لأنه في حالة الكرونيك تبدي activation of fibroblast and produce extracellular matrix. فيكون عندنا يكون associated with thickening of the alveolar septa due to fibrosis, and the alveolar spaces contain numerous hemosiderin laden macrophage يعني characteristic feature للchronic pulmonary congestion. تكون presence of hemosiderin laden macrophage يسمونها heart failure cells. heart failure cells. As we see here in the affected lung, chronic pulmonary congestion appear thickening in the alveolar septa due to fibrosis and infiltration of the chronic inflammatory cells, and يعني resulting in contraction or compression of or retraction of alveolar spaces will تكون containing hemosiderin laden macrophage. hemosiderin laden macrophage اللي يسموها الهارت failure cells. هاي يعني تكون mostly associated with rusty sputum الزنجاري, and أكيد راح تكون associated with dyspnea. الهيموريج means extravasation of blood from the vessels into extracellular tissue due to rupture of microcirculation or large vessels, rupture of large arteries or veins, mostly due to vascular injury including trauma, atherosclerosis, inflammatory or neoplastic erosion. Hemorrhage may be external or internal, means enclosed within the tissue. And some terms related to hemorrhage process. Hematoma, hemorrhage means hemorrhage enclosed and accumulate within the tissue. And the hematoma may be relatively insignificant, as in the bruise, insignificant volume, or maybe significant, accumulation of sufficient blood to cause death. Sufficient blood to cause death. For example, massive retroperitoneal hematoma resulting from rupture of dissecting aortic aneurysm, or sometimes حتى إذا كان يعني insignificant يكون little or small area of hemorrhage, but appear in يعني occur in vital organs such as in the brain. In this case may lead to يعني يعتبر life threatening و may lead to death وإن كان يعني insignificant volume. Here typical example about cerebral hematoma اللي هو يعتبر fatal intracerebral hemorrhage, even relatively inconsequential volume وإن كان little, of hemorrhage in the critical location or vital organs, as here in the brain, or into a closed space such as a cranium, can have a fatal outcome. يعني consequence مالته وإن كان small area of small volume of hemorrhage ممكن إنه lead to death. Other type of hemorrhage والpetechial أو الpetechium اللي تكون يعني السايز مالته minute يعني ranges from 1 to 2 millimeter in diameter. الهemorrhagic spots mostly يعني appear in the skin, mucous membrane or serosal surfaces, as we see here. Punctate petechial hemorrhage in colonic mucosal surfaces. Colonic mucosal surfaces يكون السايز مالته 1 to 2 millimeter in diameter ونسميها petechium. عندنا البوربوراس يكون slightly larger than petechia والسايز مالته ranges from 3 to 5 millimeter in diameter of hemorrhagic spots, may associated with many of the same disorders that induced by petechia, as well as in the setting of trauma, vascular inflammation, vasculitis, or increased vascular fragility is the most common cause. Here is the typical example in the testis, purpura in the testis. This area of hemorrhage, which characterized by the size ranges from 3 to 5 millimeter in diameter. عندنا الإكيموسيس تكون larger than purpura and ranges from 1 to 2 سنتيمتر. هنا صارت عندنا بالسنتيمتر لأنه كان عندنا بالمليمتر، بالبتيكيا 1 to 2 مليمتر، بالبوربورا 3 to 5 مليمتر. هنا صار عندنا 1 to 2 سنتيمتر. subcutaneous hematoma يسمونه sometimes subcutaneous hematomas or bruises. The erythrocyte, in this case the erythrocyte in this local hemorrhage degraded and phagocytosed by phagocytic cells, mainly by macrophages, and the hemoglobin well اللي يبين من early stage بين red blue. early stage تبين red لأنه نتيجة releasing of hemoglobin, and then the hemoglobin enzymatically degraded converted to bilirubin, بعدين يكون الكلر مالتها greenish, and eventually the hemo يعني convert into golden brown represented by hemosiderin color, accounting for the characteristic color changes in the hematome. تبدي red blue and greenish blue green, and finally golden brown, early stage of ecchymosis resolution. Here a typical example about the hemorrhage, يعني pulmonary hemorrhage. نشوف هاي كلها alveolar spaces على microscopic feature of the lung. كل هاي alveolar spaces نشوفها filled with the whole blood, and this represent the alveolar septa. When we go on the high magnification, appear clear. The alveolar space is filled with the whole blood, and this represents the alveolar septa. Also on high magnification, whole blood containing massive RBCs, inflammatory cells, and this represents the alveolar septa. Here other example about the renal or kidney hemorrhage or bleeding, characterized by presence of whole blood in the renal tubules, as we see here, and on the high magnification appear clear the presence of blood and RBCs in the renal tubules. This is a typical example about kidney hemorrhage. Okay. Assalamu alaikum wa rahmatullahi wa barakatuh.